It is not enough to tell the president, open up, don't close. Open up, don't close. Now, when you are closed, we did very well. The day the thing was opened, now some of us who are beyond 40, those of us who are beyond 40, we are looking for holes to hide. Because you have seen, the thing has spiked all over, everywhere. Waziri, I want to request you that please let us have testing facilities in this place. Let us do that. We have had reports that most people in this country are asymptomatic. Maybe here, that might be the reality. Perhaps if we could have testing facilities in all places, maybe this pandemic, the reality of this pandemic will be real, will be realized, with our people. I want to thank you very much, Waziri.
Thank you very much, Senator. From the outset, let me just first say thank you to the Governor Martin Wambora, and to say it's a pleasure being here in Embu. It's not the first time for us. We have been here before. And I just want to say that your welcome is appreciated. We were very, very, very warmly welcomed here, and I want to thank you and your government for that. As you know, we are undertaking visits across the country to just take stock of the level of readiness and to identify the gaps for enforcement as we intensify our efforts to safeguard public health. We cannot afford to rest on our achievements attained so far, as correctly put by Senator Peter Ndwega, because this disease is here with us, and it is spreading and ravaging our people in all the counties. This preparedness that we are looking for is essentially to invest in firefighting against the disease in the future. The activities of visiting and going around also give us an opportunity to motivate and encourage healthcare workers for their hard work as they handle the difficult assignments of fighting this virus. Fellow Kenyans, I'm very encouraged by the level of preparedness in most of the counties that we have visited so far. I must also acknowledge that not all counties are at the same level of readiness. Indeed, there are many who have met and surpassed the 300-bed isolation facilities that His Excellency President Uhuru Kenyatta mandated that we must have in each county as a minimum. Here in Embu, I'm very pleased to note that the county government, as has been explained by the governor, has already established over 360 beds in readiness for the management of COVID-19, and an additional 18 ICU beds. And indeed, not only are they ready, it's a great thing to see. It's just well done. And I want to congratulate the Embu people. I want to congratulate you. I want to say hongera. Hongera, in case the governor has assured me that in case anything else were to arise, he is also able to expand into other areas that are not necessarily in this. And this is a big hospital. This is not a small hospital with over 1,000 beds, inclusive. When you add all of them, you go almost to 1,000 beds, and that's a big job. And I want to thank you, Governor, because that care is not just for Embu County. It also serves, I'm told, very many other counties, all the way from Kitui, Kirinyaga, and the others. So, Asante. So this preparedness that you have, Governor, is beyond what the presidential directive was, and I want to thank you for that achievement. This is key, considering that Embu County has only two recorded positive cases, and is ranked actually at number 39 out of the 43 counties that have so far recorded cases. But the reason why we are here as a team from the Ministry of Health is to try and urge the Embu people to keep it that way. We don't compete for the higher number. Compete for the lower number. So there is nothing to be proud of by saying how many, we are so many. We should be ready and we should be happy that our ICU beds, the COVID-19 ICU beds are empty. The isolation centers here are empty. This is what we should be thankful to God. This is only because of the care and protection that has been there. And we have said, and I repeat, that because of the movement of people, the free movement of people now across the country, it is likely that you might find visitors who will bring it here, especially those people who are coming from Nairobi. I come from Nairobi as well, but you can see I'm keeping my... Na mtu wa Nairobi, mwambie akae kama mimi. Akae akiweka nini? Akiweka social distance. Akikukaribia, mwambie arudi Nairobi. Lakini ikiwezekana sana, people in Nairobi should stay in Nairobi. You are not, the governor is not actually welcoming you here. So, kaeni huko tu. But as has been mentioned, the fact that you have got only that you had had only 2 cases, I am aware that there are 21 persons in quarantine at the moment, but we hope that these ones will also turn negative. But this situation can easily change. So to provide comprehensive medical care to our people calls for additional accessories and skilled human capacity. And I'm glad that there is training, continuous training, going on in this hospital. I'm informed that to boost its intensive care capacity, Embu County requires additional auxiliary equipment such as ventilators, patient monitors, infusion, syringe feed pumps to the existing ICU infrastructure. I think I don't want to repeat what the governor has said in terms of the ministry, what the ministry has provided in support, in addition to the 5 billion shillings that President Kenyatta ordered be given to the counties for their level of preparedness and to improve the level of preparedness. And I know that Embu is going to get the money. I know that the 48.5 million for the healthcare workers, for frontline healthcare workers is already here. And I know that there will be a happy lot in a very short time. Fellow Kenyans, I wish to emphasize that the success of our efforts as a country in combating the pandemic depends on the collaboration and cooperation of all Kenyans. This includes not only the deliberate effort by the government to access and to share accurate information on COVID-19, but also the desire of the people to pay keen attention to the information provided. As a ministry, we will continue to offer leadership in the fight against COVID-19 in the country. And we are going to take a couple of steps that we are already doing. For example, we want to support the emergency responses in the implementation of the rollout of policies and guidelines. We want to support the monitoring and evaluating key action in public health, ensuring effectiveness and efficiency in achieving the stated strategic goals of the government to detect, contain, manage, and communicate properly on the status of COVID-19. And we want to mobilize resources to ensure the implementation of the key actions needed to actualize the containment measures. My brothers and sisters, as we have often stated, to control the spread of the virus in our communities, it calls for personal responsibility in observing the containment measures. And we cannot say this enough. And I want to propose to you a new slogan today. I know that we have been saying, you can get it, I can get it, and you know all the other things. But today I want to propose another one. You save me, I save you. Wewe niokoe, na mimi nikuokoe. Let's save each other. This is what is called personal responsibility. Hiyo ndio kuchukua jukumu lako kiukamilifu na kumaliza hii virusi. Ukimwi isimulimaliza ama bado iko? I know it is there even in Embu, hata ukimwi iko, lakini nazungumza juu ya virusi. Hii virusi COVID-19. Kwa hivyo, you save me, I save you. If we agree that we are going to save each other, so that if I go too close to the governor, he can point at me and say, you save me, I will save you. All right? So you take the responsibility of saving your friend. Take the responsibility of saving your child. Take the responsibility of saving your mother. Take the responsibility of saving your father. Take the responsibility of saving your friend. When you go very close to your friend and you don't know whether you are positive or negative, and I have told people, assume the person is positive, then you are not saving your friend. So let's just agree that I want to save you, so please save me. I want to save you, so save me. And it is by observing the containment measures that we can be able to do that. And that is why, when we observe some of the misbehavior that is going on, we become a bit saddened. For example, as I know that Senator Dwega alluded to the issue of illicit brewing. We are aware indeed that there is illicit brewing of alcohol here in Embu. In fact, we are told, Governor, that one of the key producers of this illicit brew actually goes around with Natugari. He goes around distributing. Not only is he cooking it where it is supposed, is it brewing or cooking or what? One of those. Not only is he brewing this stuff, he is actually distributing it as if he is East African breweries. Anachukua gari yake, anapeleka kila pahali. Hata nasikia zingine. So let him be told. We are aware. And in fact, from here, the next person I am going to report this person to, I am going to go and tell CS Matiangi, nimetumwa na watu wa Embu, waondolewe hiyo pombe. Si ndio? Nimwate kirogo watu waitu. Hiyo jo hiyo. Gera Matiangi ogwo. Haya. Ingine, I am also aware that the growing of mogoka. Si iko pia? Hiyo mogoka is common. And so does a chewing of stimulants on a miraa. So according to the data provided by the National Agency for Campaign Against Drug Abuse, Nakanda, about 50% of the youth in this county use the stimulant, abandoning and breaking all social distancing rules. Wale wanakura miraa, wanashuna wakiwa pamoja. Na mogoka. So I want to appeal to the partakers of mogoka that you must embrace individual responsibility in protecting yourself. Onoko ni uliaga miraa. Ule miraa ugiprotectaga miraa tocio muliaga nake miraa. Todo mogia kwimenyerera uliriaga miraa wi wiki. Todo acio muliaga na miraa ni magukua. Ndio. Uliriaga miraa wiki. Koguo wewe atu miraa twakui. Uikare hale agakona ine na kioro ikerega kona karia kangi na kungihote kalitigana na miraa. Lakini ikiwa ni lazima, keep your distance. And it is for that reason that I also want to mention that today Today we have hit one of the highest numbers that we expect to see in the country. Some 688 people have tested positive today in the last 24 hours from a sample size of 4,522. That's a large number, my friends. That's a big number. What it tells you is that the virus has really spread into the community, because most of these people are still in Nairobi, but additionally, we are also seeing new counties getting it. We now have 12,750 positive cases, with a cumulative total of 238,163. Again, Wenzangu, male, out of that number, 425 are men, while 263 are female. Age-wise, again, we have seen this trend continuing. A 7-month, while the oldest is 95. So Nairobi now is quite heavily infested. It leads the cumulative total of 7,298, followed by Mombasa at 1,812. Kiambu is third at 725. Tana River County now becomes the latest county to record a case, bringing now to 44 the total number of counties affected so far. Embu County, as I said, has remained fairly safe, and I hope that none of the people I've read are heading towards Embu. I'm also delighted to inform you that today 457 patients have recovered from the disease. From this figure, 401 have been under home-based care, while 56 have been discharged from the various hospitals. So the number of people now we have discharged out of the cases that I have mentioned. I've mentioned about the 12,000 cases, but it means therefore that 4,440 out of those cases have now been discharged. And I would like to thank, because it is because of you that these people have been cured. However, on a sad note, we have also lost 3 patients due to the disease, and therefore to date, we have now lost 225 people to COVID-19. And I wish, on my own behalf, on behalf of the Ministry of Health, and indeed on behalf of all of us, we wish to pass our sincere condolences to the families and friends of those who have lost their loved ones. As I conclude, let me also take this opportunity to say that I did not come here alone. I came with a team from the Ministry of Health and some other friends. So you have all met Dr. Patrick G. Then we have got Mary Nandiri, Daktari, with us, who is the acting director of nursing. We have got Laban Thega. Where is Laban? He's around. Laban Thega is acting director for health services. And where is Mamo? Oh, Mamo, yes. And Mamo, head of the division of the National Public Health Laboratory Services, who are the people who actually do the sample. But in addition to those friends, and before I open the floor for the media to ask the questions, I have also accompanied by another friend whose name is Kawala Amina. I want to invite my friend here so that I can greet her and she can make a speech. Maybe you can bring down this. This is my friend Amina. Amina, please come here. Yeah, right there. And let's listen to her.
Hi, my name is Haula Amina, and I have a plan for coronavirus, and so that people can know that corona is not a joke, and I'm the voice of the little ones. COVID-19, lockdown, curfew, keeping distance. Who will explain to me? I'm not going to school. Mommy says no friends in the house, no going out, no greeting, no good night house. Only wash your hands, wash your hands, wash your hands, wash your hands. Keep your distance, keep your distance, keep your distance. Stay home, stay home, stay home. Wear mask, wear mask, wear mask. Who will explain to me? Mommy is not going to work. Always working on the computer. How now? Home is not job. She's not talking to me. Working. I watch my cartoons. I read my storybooks. I draw pictures. I enjoy. But I don't like it. I miss my friends. Someone explain to the children, what is corona? Where did it come from? Why has life changed? I'll make a prayer. Dear God, bring back our lives. Cure the people in corona. I know you hear little children, but I beg you, take away corona. But remember, if we treat this disease normally, it will treat us abnormally. Thank you. This is Haula Amina, the voice of the little ones. Bye. Mwah. Thank you.
Thank you. Thank you very much. I think the message is very clear. And if Amina knows about this disease, then you should know about this disease. Thank you so much. Thank you, and God bless you. Let me now give an opportunity to the members of the Fourth Estate to raise one or two questions, and then we can call it a day.
Thank you so much. Good afternoon, Waziri. My name is Melita Oletenges from NTV. My first question would be, Nairobi Senator and the chair of the ad hoc committee on COVID-19 pandemic was arrested by over an allegations of drinking over hours. Perhaps what is your stand on that, and what action will be taken to the senator and the management of this particular